Universal Health Coverage Day 2024 focuses on the role of financial protection in accelerating progress towards universal health coverage. Over the last 20 years, financial protection has progressively deteriorated, with 2 billion people experiencing financial hardship and 1.3 billion people pushed into poverty due to health spending. Healthier populations build communities that are more resilient, productive, peaceful, and prosperous. Health for all is prerequisite to achieving the Sustainable Development Goals. In spite of numerous high-level political commitments to achieve universal health coverage by 2030, over half of the world's population still has no access to essential health services. This Universal Health Coverage Day, WHO calls for urgent action to put financial protection measures in place.
Universal Health Coverage Day is a reminder that health for all means everyone can access the health services they need without financial hardship. That's the world that WHO is working for.
As he clears his desk to attend to LugardTV, the Executive Secretary, Kogi State Health Insurance Agency, Dr. Aledare Adekunle, said universal health coverage is a journey led by the former governor of Kogi State, Alhaji Yaya Bello, noting that health is a fundamental human right, even as he appreciated the present administration of Governor Ahmed Usman Ododo for prioritizing health care in the state.
I want to thank the government of Alhaji Ahmed Usman Ododo for prioritizing health, and I want to say emphatically that Kogi State is in the right direction for universal health coverage. Immediately he assumed office, he also prioritized health as one of the thematic areas of focus of his administration.
According to Dr. Adekunle, the present administration of Governor Ododo has ensured that Kogi State Health Insurance Agency is well funded, adding that it has revitalized about 70 primary health care centers, reaffirming that the present administration has brought quality health care to the doorsteps of Kogi without payment.
The agency, which is Kogi State Insurance Agency, which has a mandate to ensure that people have access to quality and affordable healthcare services, is well funded. So we are well funded to provide access to quality and affordable healthcare services to the people. The government of His Excellency Alhaji Ahmed Usman Ododo has revitalized 70 primary healthcare centers, 3 primary healthcare centers per local government, and we have 21 local government. That is 63 primary healthcare. In addition to build 7 new primary healthcare centers, making it 70.
As part of measures to universal health coverage for the vulnerable in the state, Dr. Adekunle has this to say.
By creating a state equity program, which is a safety net, Bello Care, we are able to onboard about 14,000 vulnerable persons into Kogi State Health Insurance Agency, fully funded 100% by the state government for pregnant women, children less than 5 years of age, people with disability, elderly persons above 65 years of age, the indigent citizen, people that are poor, that don't even have the pocket to pay for their healthcare expenditure. So that is what the government has done, which shows the political and the financial commitment of Kogi State government to universal health coverage. We are also implementing the Basic Healthcare Provision Fund, which is a federal government grant, and we are covering about 98,000 people under the federal government Basic Healthcare Provision Fund. So all this is to expand access to quality healthcare services.
Giving statistics of those under Kogi State Universal Health Coverage, Dr. Adekunle said the agency is not leaving any stone unturned in terms of health care services.
We have been able to bring healthcare to the doorstep of people. Those 98,000 people that we are covering under the Basic Healthcare Provision Fund, they are all accessing healthcare services in one PAC per ward. So there is no ward out of the 239 wards we have in Kogi State that does not have a minimum of 300 persons that are vulnerable and are accessing free healthcare services from those PACs, courtesy of the state government in collaboration with the federal government.
The Executive Secretary maintained that government cannot do it alone, calling on well-meaning Kogites, including NGOs, to support the agency.
The World Health Organization, WHO, UNICEF, they are also supporting Kogi State Health Insurance Agency. All hands must be on deck. Is a collective responsibility, irrespective of your socioeconomic status or your tribal affiliation or your tribal extraction. You should have access to quality healthcare services. I will say that Kogi State Government is in the right direction to universal health coverage. We have started the journey to universal health coverage, and by the grace of God, with the support of His Excellency Alhaji Ahmed Usman Ododo, we are going to attain universal health coverage even before 2030, which is the global target.
This year's theme centered on health. It's on the government. Jonathan Lirama for LugardTV.